Root canal treatment in teeth with immature apices is a difficult procedure to perform. In this video, you're going to observe pulp capping in a tooth with open apexes. Here is a radiograph of mandibular right region with the first molar having extensive decay and open apexes. The patient had no clinical signs and was sensitive to cold. The pulp was diagnosed as reversible pulpitis, and the periapical tissues showed no signs of periapical pathosis. The treatment plan for this tooth in this young patient was to perform apexogenesis with MTA. After establishing profound anesthesia and application of rubber dam, gross caries is initially removed with the aid of a new and large round burr in a high-speed handpiece and in the presence of constant irrigation with sterile saline. Additional decay is removed with the use of a large spoon excavator. Final removal of carious dentin is accomplished with a large, sharp round burr in a high-speed handpiece under constant irrigation with sterile saline. Clinicians with less experience can perform this part of the procedure at low speed. Two large exposures are present in this tooth. The hemorrhage is controlled by placement of a cotton pellet saturated with 2.5% sodium hypochlorite. The exposure sites are seen after hemorrhage control. MTA is placed on the exposed pulp and padded in place with a moist cotton pellet. Additional MTA is added with a large amalgam carrier. Because MTA sets in the presence of moisture over a 3 to 4 hour period, a wet cotton pellet is placed over the material and the rest of the cavity is filled with a temporary filling material. Alternatively, the entire cavity can be filled with MTA and protected with a wet piece of gauze for 3 to 4 hours. A post-op radiograph taken after placement of MTA shows the extent of the decay in this tooth. Because the entire cavity was filled with MTA for this patient, the coronal 3 to 4 millimeters of MTA was removed a week later with a large round burr under water spray. The cavity is then filled with bonded amalgam. Another post-op radiograph was taken after placement of amalgam. A continued apical growth of the roots with normal apices is observed 4 years after pulp capping. There were no unwarranted clinical signs and symptoms in this patient, nor were there any radiographic signs of calcific metamorphosis in the pulp chamber or the root canals of this tooth.